Today's Community Focus, Attorney General Peter Neronha says the governor is not doing enough to help Rhode Island push back against federal policies that are harming residents. And to explain why he thinks so, the Attorney General joins me live now in studio to talk about that and much more. Thanks for being here.
Sure.
And so last week you made the case to lawmakers reviewing the state's budget to give your office additional funding, which the governor declined to do. I want to play a portion of your comments just now.
If this governor really believed that Donald Trump was a danger to our democracy, as he plainly is, he would be standing with my office instead of trying to thwart it. He would be enhancing my budget instead of trying to hurt it.
So what are you asking for in terms of funding for your office, and why is this something that gets you so fired up?
Yeah, because, I feel like the issue of pushing back against the Trump administration is incredibly important. I don't think I need to go into detail why. It's only my office that has the ability to fight back for Rhode Islanders. Nobody else can or is doing it. And my people are carrying all the work that they do if Donald Trump wasn't president and doing all this work on top of it. We can win, and we are winning. But a small investment in my office means not only are we making sure the president stays within the bounds of the law, but we're protecting tens of millions of dollars for Rhode Islanders. So just think about it for a minute. When the president froze funding, he froze effectively 1/3 of the state's budget. That's $5 billion. So a small investment in my office to protect that $5 billion, I think is a worthy investment.
And I wanted to ask you about the Trump administration. Since President Trump took office, your office has been busy joining or even spearheading lawsuits against Trump administration policies, pushing back on everything from the funding freezes, as you mentioned, mass firings, dismantling the Department of Education. How do you weigh the balance of the new administration with the local matters your office is dealing with?
Yeah, well, we're doing all of them because my people are working incredibly hard. There's 300 lawyers employed by the state. I have about 100 of them, and they're working incredibly hard and incredibly well. But I know that I could hire 5 incredible lawyers tomorrow that are actually ready to leave federal service because of what the Trump administration is doing, to join us, do work for Rhode Islanders, sort of the home stuff that we talk about, but also get out on offense against the administration as it tries to sideline the Congress and undermine the judiciary and threaten our democracy. I'm really anxious to get those people on board. If at the end of the day I have to fund them myself out of a pot of money like I did the last time we got FTEs, like no other state agency I might add, from recoveries we made in the opioid cases, not for opioid prevention, but for legal fees, that I'll use that money because it's that important to me.
I also wanted to ask you, just before we came on air here, you were telling me about some impacts to the State Department of Health from the federal level. Can you talk a little bit more about that?
Just today, the Department of Health learned from the federal government that they've abruptly canceled $30 million of monies used for childhood vaccination, to plan for a pandemic, how to respond to one. Look, the state's going to have to make the decision. Either we're going to continue doing that work at state expense or not do it at all. But if there's a fight to be had there, and I believe there is, it is my office that will do that fight, lead that fight, keep that money for the state. That's why, to me, it's so important that the state invest in my office and the governor stand with us. If he's true to his word, that he believes that Donald Trump is a threat to democracy, he knows who to stand with, and it's me in my office.
And about what dollar amount are you asking for?
It was roughly $2 million. Well, like I said, Kayla, what's really important, there are always two things in the budget. It's the FTEs, meaning the positions, and the money. I don't think that my office should continually have to pay for ourselves effectively. I don't think that's what's in the best interest of the office long term. But I can do it, and I will do it if I have to, like I did 2 years ago when I got 15 positions. Again, the governor didn't want to give them to me. The Speaker, the Senate President did. We were able to hire those 15 lawyers with money that we recovered, cost the taxpayers nothing, and they are delivering for Rhode Islanders every day.
I want to switch gears here a bit and ask you about what's happening with South County Hospital. The fight over the future of the facility has now sparked a legal showdown between hospital executives and advocates. You've been outspoken on the state of Rhode Island's healthcare system. So what's your take with what's going on? What are you hearing from people involved in this?
Yeah, well, just very briefly, the state of our healthcare system is it's in crisis, and our leaders in government don't seem to appreciate that. And so there will be spectacular failure, and when it comes, we're going to be in trouble. South County Hospital, I think, isn't so much about that. They actually ought to be doing well given their patient mix. It tends to be less Medicaid, more Medicare, more commercial, so the revenue stream is better. But there's plainly a disconnect there among some aspects of the hospital leadership and the men and women who work there, or some portion of them, and they really need to resolve it. To the extent I can help that, I will. I've tried to be proactive on healthcare. There's plenty more work to do there.
And just finally here, any update you can give us on your cold case unit? Any progress being made in any local cases?
Yeah, there's a lot of progress being made. You know, the forensic science advances are really helping us, and we're putting the last few dots on the I and crosses on the tops of the T's. But we hope to be able to push something out on that very soon.
All right. Unfortunately, that's all the time we have. Attorney General Peter Neronha, thanks for being here.
Thanks, Kayla.